All right, so today we're going to do a deep dive into freebasing cocaine,
Okay.
which is something that, you hear about, and it's a pretty fascinating but dark topic.
Mm-hmm.
We're going to kind of look at, you know, how it works, why people would choose this method when it's known to be so dangerous, and what makes it different from other forms of cocaine,
Right.
and delve into the science behind its effects.
Yeah, freebasing is interesting because it's not just using cocaine, it's actually changing the chemical structure of it. And by
Yeah.
doing that, you change a lot of its properties. So we're talking about separating the base form of cocaine
Uh-huh.
from the hydrochloride salt.
Yeah.
And that makes all the difference. The result is like a much more potent drug that hits your system a lot faster.
And harder.
Uh,
So it's not just about taking a bigger dose. It's like creating a whole new beast, so to speak.
that's a good way to put it.
But before we get into that, I think we should get our terms straight first.
Yeah.
Because people often get this confused with, powder cocaine
Yeah.
and crack cocaine. So can you walk us through what the differences are between those?
Absolutely. So powder cocaine is the most common form. It's a
The one you see?
on TV and in movies.
Yeah.
That's cocaine, hydrochloride salt. You can snort that. You can dissolve it in water and inject it, or even rub it on your gums.
Okay.
Freebasing, on the other hand, is about isolating the pure cocaine base. So that means getting rid of that hydrochloride.
Okay.
And that's where things get a little tricky.
Okay, tricky how?
Because the process involves some pretty volatile chemicals, things like ammonia and ether. And those are highly flammable. And that's where the risk of explosions comes in. You're kind of creating a mini drug lab, which is never a good idea.
Right. So already we're seeing
Yeah.
that there's a higher level of risk just in making the drug.
Right.
But how does this compare to crack cocaine? Is that essentially the same thing?
Crack cocaine is kind of like the less refined cousin of freebase.
Oh, right.
It's also a smokable form of cocaine, and it's made by mixing powdered cocaine with baking soda and water, and then heating it up until it solidifies. But the thing is, crack cocaine is usually less pure than freebase, and often contains other impurities.
Okay, so freebase is like the high-end version.
Yeah,
It's more potent
it is.
and therefore more dangerous.
More dangerous. Yep.
Okay, and this purity is part of why it's considered so risky.
That's a big part of it. It's like taking a shortcut to the most intense high that cocaine can offer, but with really potentially devastating consequences. And remember, we're talking about a drug that already has a reputation for being highly addictive and dangerous.
Right. You mentioned that. The way that freebase is made is pretty hazardous. But what about the effects themselves? How does this intense, rapid high actually impact the brain and body?
So it's all about how quickly the drug reaches the reward centers in the brain. So think of it like this. The faster the drug gets there, the bigger the surge of dopamine, which is the feel-good chemical. And freebase, because of its purity, and the fact that it's usually smoked, delivers that rush almost instantly.
So it's basically flooding the brain with dopamine,
Yeah.
creating that euphoric high. But then what happens? There has to be a downside.
Oh, absolutely. What goes up must come down. And with freebase, that come down can be brutal. You're talking extreme irritability, anxiety, even paranoia. As that high fades away, it's like your brain is desperately trying to rebalance itself after being thrown completely out of whack.
So you're riding this incredible high, and then you're slammed back down to earth,
Huh?
feeling worse than you did before.
That's a good way to put it.
And this is where the addictive nature really takes hold.
Exactly. This is where it starts.
Because you're trying to avoid that crash
Right.
that happens after.
People find themselves chasing that initial rush, and that leads to a dangerous cycle of repeated use, and each time needing more and more to achieve the same high.
So it's just a recipe for disaster. But let's break down the specific short-term effects. You mentioned irritability, anxiety.
Yeah.
What else are we talking about here?
So in the short term, you can experience intense headaches, nausea, insomnia, your blood pressure and heart rate skyrocket. Essentially, your entire body is in overdrive, and it can't sustain that for very long.
So even a single use
Mm.
can really mess with your body.
Oh, yeah. In very significant ways.
And I'm guessing this is just the tip of the iceberg.
This is just the beginning. The long-term consequences of freebase use can be even more devastating, but to give you just a glimpse, we're talking chronic depression, memory problems, even hallucinations.
Wow.
A pretty grim picture.
Yeah, that sounds pretty grim.
And-
And we haven't even touched on the specific risks associated with smoking
Right.
freebase cocaine.
Yeah.
Because it's not just the drug itself, it's also the way it's consumed.
Yeah.
That adds another layer of
Yeah.
danger.
Exactly, because Smoking anything is inherently harmful to your lungs.
Mhm.
But when you're inhaling the superheated vapor of freebase cocaine, you're introducing a whole host of toxic chemicals directly into your respiratory system,
Oh,
so the damage can be severe and long-lasting.
it sounds like we're about to uncover a whole world of trouble
We are.
with freebase cocaine.
Yeah.
So let's dive deeper into those long-term health risks, including the terrifying reality of a cocaine overdose when we come back.
Yeah.
So we were discussing the short-term effects of freebase,
Right.
and you mentioned that long-term use could lead to some pretty serious issues.
It really can. What starts as a quest for pleasure quickly turns into a battle against a whole host of health problems.
Yeah.
And we're not just talking about physical stuff. Freebasing
Yeah.
can really mess with your mental health.
Yeah, so it's like your mind is being hijacked by this drug.
That's a good way to put it. So, you know that dopamine rush we talked about? Well, over time, the brain actually becomes less sensitive to it. That means users need more and more of the drug just to feel normal, let alone experience that initial euphoria.
Right.
And this is what we call tolerance. And it's a classic hallmark of addiction.
So it's like a trap. You start chasing a feeling
Yeah.
that you can never quite recapture.
Right.
And in the process, you kind of lose yourself.
You do. And as the addiction takes hold, the cravings become all-consuming. It's not even about wanting to feel good anymore. It's about needing the drug to function, to stave off those agonizing withdrawal symptoms.
And what are some of those withdrawal symptoms? I imagine they're pretty awful.
They can be pretty bad. Intense fatigue, depression, anxiety, agitation, insomnia. Some people experience vivid nightmares and intense cravings that can last for weeks or even months.
It sounds like a nightmare that you can't wake up from.
Yeah, it can really feel that way. And as the addiction progresses, people often isolate themselves. They start neglecting their responsibilities and their relationships. Their whole world shrinks down to the pursuit of the drug.
So it's not just a personal struggle. It really impacts every aspect of their life.
Every aspect. The
Mm.
ripple effects of addiction extend to families, friends, communities. It's a heartbreaking reality.
Yeah, absolutely. We've talked about the psychological toll, but let's go back to those physical health risks. Before we went to break, we were talking about the impact of smoking on the lungs. Can you talk more about that?
Right. So as I mentioned, smoking anything is bad news for your lungs. But with freebasing, you're dealing with a really potent cocktail of chemicals. They're even more damaging. The intense heat of the vapor can literally burn the delicate tissues in your lungs.
It's like setting fire to your insides.
It's not far off. And over time, that damage can lead to a whole range of respiratory problems. We're talking chronic bronchitis, emphysema, even lung cancer.
So even if you avoid an overdose, you're still risking a slow and painful decline
No.
in your lung function.
Exactly. And those risks are compounded by the fact that cocaine suppresses the immune system,
Oh, wow.
which means freebasers are much more susceptible to infections like pneumonia and tuberculosis.
So it's like a double whammy. You're damaging your lungs,
Yeah.
and then you're making them more susceptible to other diseases.
That's right. That's the tragic reality of freebase cocaine. It attacks the body on multiple fronts.
Yeah,
And we haven't even talked about the impact on the heart.
that's right. So we know that cocaine is a powerful stimulant, but what makes freebasing particularly dangerous for the cardiovascular system?
Well, think about it this way. You're taking a very potent form of cocaine and delivering it directly to your bloodstream via your lungs. So that means it hits the heart with incredible force. We're talking about a sudden surge in blood pressure, a racing heart rate, constricted blood vessels.
So like a shock to the system,
It is.
this jolt of energy
Yeah.
that the heart really isn't equipped to handle.
Exactly. And that can trigger a whole cascade of problems, from irregular heart rhythms to heart attacks and strokes.
Wow.
And remember, this can happen even in young, seemingly healthy individuals.
So it's not just people with pre-existing heart conditions. This is something that can strike anyone who uses freebase cocaine.
Absolutely. And the risk is amplified with every use over time. The repeated stress on the cardiovascular system can lead to permanent damage, increasing the likelihood of long-term heart problems.
It's terrifying to think that one bad decision, one moment of seeking pleasure,
Yeah.
can have such profound and lasting consequences.
Yeah, it really is. And that brings us to another critical aspect of freebasing, the risk of overdose. We touched on this earlier, but I think it's so important that we dive deeper
Yeah.
into the warning signs and the potential dangers.
Okay, so let's talk about that now. This deep dive into freebasing cocaine has been pretty intense.
It has been a heavy conversation.
Yeah, but it's been eye-opening for sure.
I think it's important to have these discussions because a lot of this stuff is hidden below the surface, you know?
Yeah, and I think one of the most pressing dangers is the risk of overdosing,
Absolutely.
which you said earlier can happen to anyone who
Yeah.
uses Freebase,
Yeah.
regardless of,
Right.
health history or anything.
Doesn't matter.
So can you walk us through the signs of a cocaine overdose?
Mm-hmm.
Like, what should people be looking out for?
So one of the first things you'll notice is a pretty dramatic shift in their behavior. They may become very agitated, restless, possibly even paranoid. Physically, you may see rapid breathing, excessive sweating, a racing or irregular heartbeat.
So it's not always obvious.
Right.
It could be easy to miss those early warning signs.
It really could, especially if you don't know what to look for.
Right.
And that's why it's so important to be aware of these signs, because a cocaine overdose can escalate very quickly.
Yeah.
You might see tremors, seizures, even a loss of consciousness. Their skin may turn bluish and their breathing could become shallow or stop altogether.
So this is a life or death situation.
It is.
Every second counts.
Every second counts.
So if you suspect that someone is overdosing on cocaine, you need to call 911 immediately.
Absolutely. Don't hesitate.
Don't wait to see if they get better on their own.
Right.
And while you're waiting for help to arrive, is there anything you can do to help the person?
Well, the first and foremost thing is to stay calm, talk to the person, trying to keep them conscious and responsive. If they're having a seizure, make sure they're in a safe position where they can't hurt themselves.
And I'm guessing you shouldn't try to restrain them.
No, absolutely not. Restraining someone having a seizure can actually cause more harm than good.
Okay.
Your main priority is to keep them safe until medical professionals arrive.
Okay, so we've painted a pretty bleak picture of the dangers
Yeah.
of freebasing cocaine. But it still begs the question, knowing all of this, why do people still choose this route? What drives someone to engage in such a risky behavior?
That's the million-dollar question, and there's no easy answer. You know addiction is a complex disease, and there are many factors that contribute to it.
So it's not as simple as someone just wanting to get high.
Rarely that simple. For some people, it might be a way to escape emotional pain, trauma, or just difficult life circumstances. They may be seeking a sense of control, or just a moment of relief from their troubles.
It's like a coping mechanism, but a very dangerous one.
Exactly. For others, it might be about fitting in or trying to impress their peers. Social pressure and the desire to belong can be a powerful motivator, especially among young people.
Yeah, and let's not forget about the allure of instant gratification.
Right.
We live in a world where we're constantly bombarded with messages about quick fixes and easy solutions.
Absolutely.
So it's easy to see how that mindset could translate to drug use.
It makes sense. People are looking for a shortcut to happiness, or a way to numb the pain, or escape the pressures of daily life. But the problem is, freebasing cocaine only offers a fleeting illusion of relief, and the price you pay for that brief escape can be incredibly steep.
So it's like a Faustian bargain. You're trading your health, your relationships, your future for a moment of fleeting pleasure.
It's a heartbreaking reality. But, even in the face of these grim truths, I think it's important to hold on to hope. Addiction is a disease, but it's a treatable one.
That's a really important message. There are effective therapies, support groups, and resources available to help people break free from addiction.
Absolutely.
It's not an easy journey, but recovery is possible.
It is, and there's no shame in asking for help. It's actually a sign of strength to recognize that you need support and to reach out for it.
Well said. So if you or someone you know is struggling with addiction, please don't hesitate to seek help. There are people who care, who understand, and who are dedicated to guiding you towards a healthier, happier future.
And remember, recovery isn't a linear process. There will be setbacks and challenges along the way. But with the right support, with perseverance and compassion, it is possible to reclaim your life and build a brighter future.
And on that note of hope, we are wrapping up our deep dive into freebasing cocaine. We've explored the science, the risks, and the complexities of this dangerous practice. We hope this knowledge empowers you to make informed decisions and to seek help. If you or someone you know needs it, stay curious, stay informed, and most importantly, take care of yourselves and each other